It's a great question. You know, my interest in cosmetic medicine came because of my interest in art and architecture. It was my opportunity to use the interest that I had growing up and applying it to a real world application. To me, creating symmetry is the most important aspect of cosmetic medicine, to make sure that patients have this nice natural look that we can attain with a lot of the non-surgical opportunities and procedures that we have at our arsenal today. It's another great question. There's so many to choose from, but I love creating, giving a blank canvas to work with, the patient that's naive, and kind of going through some of the recommendations as far as what neuromodulators like Botox, Dysport, and Xeomin can do, what dermal fillers would benefit patients, whether if it's in the Juvederm family or Restylane family, what some of the stimulators, biostimulators, such as Sculptra Aesthetic, Radius, and now Bellafill can provide patients, and the longevity of these makes the biggest difference. So we like to create a treatment plan. So to answer your question, I think the injectables are my favorite aspect of this industry. I love that question because every day I'm always thinking about how can we improve what we already have, and how can we make a procedure more beneficial for the patients with better outcomes, less downtime. But one of the challenges that we have in the cosmetic medical field, whether you're in the medical spa business, a dermatologist, or a plastic surgeon, the challenge of treating melasma. Melasma is the pigmentation that occurs as a result of pregnancy. Hormones can affect it. Birth control can be a culprit, but 90% of the time it's due to sun exposure. Recent study came out yesterday that actually confirmed something that I've always believed in. Hot yoga and being a cook in front of a hot stove all the time can also induce discoloration or pigmentation changes on the skin. So with that said, we throw a lot of different things at melasma, and it's a constant battle. So with those patients that suffer from it, they always know from day one that this is something that's going to be ongoing. We can treat it. We have a lot that we can treat a melasma with, but it just takes effort, continuous effort, on both the patient's part and the physician part. That's a tough question. I wear my heart on my sleeve, if you will. Most of my patients know the inner workings of my life, in and out. But what they don't know about me is that besides being extremely family oriented, I'm very dedicated to my craft, and the hours that I spend perfecting that craft is sometimes beyond what patients know and understand. Probably up until recent, I would spend 12 to 14 hours days at the office 6 days a week. So that's a little bit of a tidbit, good or bad.